What's happening, everybody? Dr. Tom Walters here from Rehab Science. I want to show you just a quick little exercise you can do today for those of you out there who might be suffering from sciatica or sciatica-like symptoms. So sciatica is sort of a cluster of symptoms. It actually isn't a true diagnosis, but it kind of produces similar symptoms in most people, and that is that individuals will often have back pain, and it may radiate down into the buttock, down the back of the thigh. Sometimes it can go past the knee and into the calf and the bottom, the sole of the foot. So, if your symptoms are really severe, and especially if you're noticing that your leg is getting weak, definitely make sure, or if you're not getting better with care, you're trying some exercise, you're not getting better, make sure you seek out your healthcare provider, especially if you notice progressive weakness, because that can be a sign that neurological health is really declining and you may need medical intervention. If you're outside of that situation, there are some exercises called nerve mobilizations. Sometimes we call them neural flossing. And they can help people with different pain conditions that may have a neurological component. So I'm just going to show you one. It's kind of a simple one you can start with. It's called sciatic flossing, sciatic mobilization. We're looking at that sciatic nerve. So what you're going to do is you're going to lie on your back and say, I'm going to pretend that my left leg is the involved or painful side. I'm going to lay here on my back and I'm going to straighten my right leg out. I'm going to bring my left leg up and I'm going to hold back here on my thigh with my hands. You can rest your head here. So what you're going to do, usually what happens with sciatica is that people, if I go and straighten my knee here, it will put my sciatic nerve on tension, on stretch, and that will at some point create pain for most people. So what we want to do is work on the ability of that nerve's ability to slide and move, which will help improve blood flow to the nerve. Again, its ability to move, and that should help overall health. So when I come up here, what you're going to do, start in this position, your knees at 90 degrees, your hips at about 90 degrees. I'm going to straighten my knee just until I start to feel tension or pain, whatever comes on first. And then what I'm going to do is I'm going to start with a flossing technique. So on this one, if I pull my toes towards my nose, that's called ankle dorsiflexion like this, that will tension the nerve even more. So in a flossing technique, my goal is to put tension on one end of the nerve, so in this case down towards my ankle, and then on the next portion of the exercise to put tension up closer to my neck, so I'll use my head. So what I'm going to do is I'm going to pull my ankle into dorsiflexion like this and leave my head just where it's at, and then I'm going to push my ankle out into plantar flexion, which puts the nerve on slack down there. So then when my ankle's pushed out this way, I'm going to lift my head, and then I'm going to go back and forth like that. So my neck and head are going to follow my ankle. I'm going to go back and forth, and I could do this, usually I'll have patients do it maybe 15 to 20 times. If it bothers your neck to lift your head like that, then you're totally fine just moving the ankle like this too. Another way is to keep my ankle on tension and just move my knee up and down. That's another way I can do it. Both of those put the sciatic nerve on tension here and then on slack. So I'm just putting it on tension and then taking it back off. Now, if your symptoms aren't quite as severe, you can try something called a tensioner. So the first one there was a flossing technique. Now we can look at a tensioning technique. So if I bring my leg up like this and I pull my ankle down, so I've got tension there, I could lift my head up and that'll create tension up by my neck and also down by my ankle. I'll hold for a few seconds and then I'll relax, maybe kind of shake it out. So you'll feel a little more stretch with this one. Again, knee straightens, pull the ankle back and lift the head. Hold there for a second, and then relax. And again, you can kind of shake it out. Sometimes going back through the flossing technique like this kind of helps loosen things back up again if you felt a big stretch there. So those are two simple techniques. That position is called the straight leg raise position. We actually use it in a clinical environment to test the sciatic nerve on patients to see if their symptoms are coming from their sciatic nerve. So that's just one way you can do it, the straight leg raise position. You've got a sciatic nerve flossing technique and a sciatic nerve tensioning technique. Like I said, with the flossing technique, usually we'll have people do maybe 2 sets of it and 15 to 20 repetitions. If you're doing the tensioning one where you feel more stretch, that one you might hold for 5 to 10 seconds and maybe you do 3 or 4 of them. And you can do that each day as much as it helps you. And let me know if you have any questions down below, and I hope you have a good rest of the day. Thanks.